One sentence can change everything. You have stage 3 kidney disease. Most people immediately wonder, am I going to die? How serious is this? As a nephrology nurse and dialysis instructor for almost 3 decades, I've heard these questions, seen the confusion, and watched it repeat itself over and over again. Patients sit across from a brilliant kidney doctor, nodding their heads in understanding, but the moment they walk out to the parking lot, they are completely flooded with confusion. They have no idea what their stage actually means for their daily life. That's why I've made it my mission to turn complex kidney disease concepts into simple, practical explanations that anyone can understand. Today, I am going to be your translator. Every day, I see people making decisions about their kidneys based on fear, confusion, and things they've read online instead of understanding what their numbers actually mean. We are breaking down the 5 stages of chronic kidney disease, looking at what is actually happening to your body, what you will feel, and exactly what you need to do right now. There are actually 2 common ways you'll hear kidney function described. One is eGFR, or estimated glomerular filtration rate. This is the number you'll often see in your lab report, and it's the one used to classify kidney disease into stages 1 through 5. The other is the urine albumin to creatinine ratio, or uACR. This one is measured from a urine sample. This tells your doctor whether protein is leaking into your urine, which can be an early sign of kidney damage, even when your estimated GFR is still normal. Today, we're going to focus on the estimated GFR staging system because that's the one most people are referring to when they talk about stage 1 through stage 5 kidney disease. Stage 1, estimated GFR is 90 or higher. Kidney damage is present, but filtering is still normal. Stage 1 means your kidneys are still filtering waste at 90 or higher capacity. If your kidneys are filtering perfectly, why did you get diagnosed? Usually, it's an accident. You log into your patient portal after a routine physical and see a scary flag next to your lab results. Physically, you will notice absolutely nothing, no symptoms. But under the hood, your kidneys filters are experiencing minor structural stress, often leaking trace amount of protein into your urine. Doctors call this stage asymptomatic, which usually means they won't bring it up during your visits. But as a nurse, I call stage 1 your ultimate wake-up call. Your focus here isn't to panic, it's to protect. Cut down the sodium, control your blood sugar, and throw away the chronic ibuprofen habits that silently scar your kidney filters. In terms of diet, there's usually no major restrictions. Continue with healthy eating and reduce your sodium. Stage 2, estimated GFR is 60 to 89. Mild loss of kidney function. In stage 2, your estimated GFR dips slightly to between 60 and 89. Your kidneys are still doing a beautiful job keeping you alive, and you still won't feel a single symptom. Your primary doctor might look at a 10% drop in your function and say, we'll just watch it. But watching it without changing anything is how stage 2 quietly slips away. This is when you must look at your trends year over year. If that number is steadily ticking downward, your lifestyle must tighten up. Keep your blood pressure strictly managed and keep your body like armor protecting those precious remaining filters. In terms of diet, limit sodium, stay hydrated as recommended, and avoid unnecessary NSAIDs, which are the non-steroidal anti-inflammatory drugs. If you're like many patients, you probably opened your patient portal, stared at these numbers, and wondered what any of them actually mean. I created a free kidney lab companion that lets you write down your own results and explains the most common kidney lab values in plain English. You can download it below, print it out, and even bring it to your next doctor's appointment. Stage 3. Estimated GFR is 30 to 59. This stage is divided in two. Stage 3A is 45 to 59. And there's mild to moderate loss of kidney function. Stage 3B is between 30 and 44, and there's moderate to severe loss of kidney function. Stage 3 is where most people finally realize something is wrong. It's also the stage where Google becomes their worst enemy. This is where your estimated GFR drops between 30 and 59, and standard lab results finally trigger an abnormal alert. I've caught 3 separate students in my own training classes who were in stage 3 and had absolutely no idea how serious their situation was. In the first half, stage 3A, you still might feel completely normal. By stage 3B, you might notice mild fatigue, swollen ankles, or foamy urine. You may also experience anemia and high blood pressure. This is the stage where patients usually panic search the internet and hit dietary paralysis. They read they have to stop eating bananas, potatoes, and whole grains, and they end up starving themselves. As your translator, let me clear the confusion. Unless your specific lab results show high potassium or phosphorus, you do not need to cut those healthy foods out yet. Your main enemies at stage 3 are still high blood pressure, high blood sugar, and excess sodium. This is the moment you demand a referral to the nephrologist to build a real defense strategy. In terms of diet, protein may begin to matter depending on your labs. Watch sodium, sometimes potassium and phosphorus depending on your labs. We'll go deeper into what to eat by stage in another video. Stage 4. Estimated GFR is between 15 and 29. Kidneys are working much less efficiently. Stage 4 is a severe drop in function with an estimated GFR between 15 and 29. Your kidneys are running on less than a third of their power, and the symptoms are no longer silent. You are dealing with profound fatigue, heavy fluid swelling, an altered taste in your mouth, and a total lack of energy. This stage is what I call a lonely no man's land. You are too sick to feel like yourself, but aren't sick enough for dialysis yet. Doctors will start talking to you about the future. Many patients freeze up and do nothing out of fear, just like the student who recently graduated from my program. He was in stage 4, completely unprepared until our classes finally opened his eyes. Stage 4 is not the time to hide from reality. It is your golden hour to plan. This is when you preserve the veins in your arms, learn about peritoneal dialysis versus hemodialysis, and look into preemptive kidney transplants so you can step into the future on your own terms, rather than rushing into an emergency room. In terms of diet, in most cases, there are protein, sodium, potassium, phosphorus, and fluid restrictions, but it all depends on your lab results. Stage 5. Lower than 15. At this stage, many patients require dialysis or a kidney transplant because the kidneys can no longer adequately perform their job. Stage 5 means your estimated GFR has dropped below 15, signaling kidney failure. Toxins and fluids are building up to dangerous levels, causing severe nausea, shortness of breath, intense skin itching, and mental fog. Life is no longer sustainable on your own. Now, after 29 years as a dialysis nurse, let me tell you what doctors sometimes fail to reassure you. Stage 5 is terrifying, but it is not the end of your story. It is the beginning of a new chapter managed by renal replacement therapy. Whether you choose home dialysis, in-center hemodialysis, or transplant, your lifestyle will shift towards managing your treatment, tracking your daily fluid weights, and working hand in hand with a specialized medical team. You may have to make big adjustments, but you can absolutely live a full, meaningful life on the other side of this number. And remember my student with stage 4 kidney disease? After finally understanding what his stage meant, he told me that the hardest part wasn't understanding the diagnosis. It was figuring out what he could actually eat. And honestly, that's one of the most common questions I hear, because the answer isn't the same for everyone. It depends on your stage and, even more importantly, your lab results. That's exactly what I break down in the video that's on your screen right now. I'll meet you there.